The Sultanate, represented by the Minister of Health, participated virtually this morning in the work of the 5th extraordinary meeting of Their Excellencies Health Ministers of the GCC states. His Excellency Dr. Ahmed bin Mohammed Al-Saidi, Minister of Health, led the Sultanate delegation in the presence of Their Excellencies Undersecretaries and other officials in the ministry. The meeting reviewed all developments related to the coronavirus COVID-19 and the measures taken in each country, as well as the current situation in the Sultanate in terms of updating the indicators of the current epidemiological situation of the COVID-19 and discuss the latest developments related to the vaccines used against coronavirus, especially the vaccines approved in the technical meetings of the Council, its guidelines, effectiveness, side effective and preventive measures adopted for the entry of the GCC citizens through various ports in the GCC countries. A presentation on the outputs of the Committee of Their Excellencies GCC Health Undersecretaries and a presentation of the experience of using vaccines in the Kingdom of Bahrain, in addition to reviewing the decisions issued in their previous meetings. At the end of the meeting, a number of important recommendations were released, which also praised the great efforts made by the health care workers, both at the government institutions and private sectors, as well as members of society in the GCC countries who have contributed positively in reducing the effect of this pandemic. They commended the increase in the rate of vaccination among GCC community members and urged them to continue to do so, along with raising awareness of the importance of vaccinations, its safety and its effectiveness, which is the basic way to protect society and beat the pandemic. Enhancing the continuation of information exchange among member states on the pandemic latest developments, viral modifications, precautionary measures, vaccination information, and the extent of the effectiveness with different ages and side effects that are monitored. The importance of continuing follow-up the implementation of precautionary measures, physical distancing, wearing of masks, and frequently washing of hands and isolation of positive cases. Approving the results of the meetings of Their Excellencies GCC Undersecretaries Committee and adopting the Gulf Guide for the users of COVID-19 vaccines and continue to update it periodically to keep pace with further scientific developments. Coordinate with the concerned authorities in each country to approve the existing applications in the GCC countries to facilitate movement between the countries of the Gulf Cooperation Council countries and work to link these applications by creating an electronic integration layer and exchanging information on immunization. Approval of allocating a budget of 1 million Saudi riyals for each country from the Council's account to conduct a genetic sequence study of COVID-19 samples. Participation in the study is optional for each country, with the importance of emphasizing the privacy of data for each country. It's worth noting that the meeting of Ministers of Health in the GCC countries was preceded by a meeting of Their Excellencies, the Undersecretaries of Health Ministries in the GCC countries last Friday, in which His Excellency Dr. Mohammed bin Saif Al-Husni, Undersecretary of the Ministry of Health for Health Affairs, and a number of officials in the ministry participated. Abdallah bin Ahmed Al-Rubaiey, Sultanate of Oman Television, Muscat.